living with arthritis can be a challenge, and I think it depends where you are in your disease, how big a challenge it is. Obviously, when you're first diagnosed, it's a big challenge, a big mountain to climb. As time goes by and you become a little more, I wouldn't say used to the disease, but accustomed to what happens to you when the disease is in flares or not in flares, then it becomes much easier to live with it and to learn to manage it, so that the goal is, of course, that you manage the disease. It doesn't manage you and your life. So I was diagnosed in my 20s and had 3 small children. I was working and leading a very active life. So it did put a bit of a crimp in my life for a while, but I was really fortunate in that the medication that I was put on worked well. And I went along for probably about 7 years and just led life as you normally would, other than getting an injection once a week and getting blood work done. Other than that, life just was as it had been. So I think I tended to put it all in the back of my mind, and that this, was there, but it wasn't really there because it wasn't stopping me. Then things happened and the medication stopped working and the wheels really fell off. Plus at that point, the disease, obviously, even though I'd been stable and able to do things, the disease was still in my body and progressing, which does happen with it. And I was starting to need to have some surgeries done. So between the medication not working and starting to have surgeries, that really impacted my working life as well as my home life, because I just wasn't able to do the things I had been doing. And even though I tried going back to work several times, even without permission, it didn't work. So I was off for quite a while, and this was really distressing to me because it was a big part of my life and who I was and what I did. And my children were growing, so this was huge. My rheumatologist, when I was in to see him on one visit, asked me to come in about a volunteer program that they were starting in London for arthritis patients. I did go to the info session, and it was called Patient Partners in Arthritis, and involved teaching people with arthritis to a level where they knew enough about a bone and joint examination to then learn that material and be able to pass it on to medical students and residents in the hope that they would then pick up and diagnose arthritis patients earlier and get them into treatment faster. So that was the basic training, and I did train as a patient partner and took part in that. And then through a just serendipitous, I guess, I ended up filling in for a while for one of the national trainers who needed to be off for surgery, and she just didn't come back. And so for the last 12 years, 13 years, I've been the national trainer for the program across Canada. It has been really successful. We're in 12 of the Canadian medical schools and interact with medical students from all levels, residents, as well as all the allied health professionals, so nurses, physiotherapists, occupational therapists. Huge impact, and really appreciated by both faculty and by the students as they go through the program, because it gives them the confidence that we're not teachers, we're not professors, we're not doctors. So it's a very relaxed, non-threatening environment for them to practice and learn their skills in, and we can give them feedback because we have the disease and we know where they should be looking and how hard they have to press or feel on your joints to know if there's something going on. So we're able to give them some clues, as well as tell them what it's like to live with the disease and the importance of early treatment and monitoring the patients on a regular basis.